Well, I'm delighted now to be joined by Dr. Tim Brewer from McGill Medical School. Tim, welcome.
Thank you. I'm very glad to be here.
Tim, so you're talking about 2011 and an important meeting that's going to take place. Tell us a little bit more about that.
Sure. So what's going to happen in 2011, which is unique in North America, is we're bringing together the three largest global health organizations, the Canadian Society for International Health, the Consortium of Universities for Global Health, and the Global Health Education Consortium, all together in a joint meeting. Part of why I think this is so wonderful and so powerful is global health, we talk about partnerships. And this is actually the first time that these three large independent organizations are all coming together in November in 2011 to meet together.
Why bring everybody together?
Well, I think one reason is because we need to start talking to each other. I think one of the themes you've probably heard from people at the meeting is there's a lot going on in global health. We're kind of tripping over each other. We're reinventing wheels. At the opening session this morning, the speaker, Dr. Obinsky, talked about how we learn through experience and wisdom, and we keep having to have the same experiences. By bringing people together, hopefully we're shifting more from that experience phase to the wisdom phase, and we're starting to share some of that collective wisdom.
What you see at an event like this, what really grabs you is the enthusiasm and the passion from young people. How important is it that we capture that enthusiasm?
So I think that's essential. You're exactly right. Students are driving global health. There was no dean that I'm aware of, there was no major faculty movement to create global health anywhere in the world. This was really a student-driven idea. And as a faculty, we've been scrambling to keep up with the demands of and the needs of our students, and that's part of what's so exciting. They bring a tremendous amount of energy and enthusiasm and idealism. And at the same time, they're not naive. Our students are really quite sophisticated, and we as a faculty really need to do a better job listening to them because we learn as much from our students, I think, as we teach them.
Now, Tim, it's been put to me this week that a lot of money is being put into global health, but what we really need now is to build capacity.
You're exactly right. So one of the countries that I work in is Ethiopia. Ethiopia has a population of 83 million people. Infectious diseases are still the number one cause of death, responsible for about 52% of all deaths in Ethiopia, and yet they have 2 physicians trained in infectious diseases in the entire country. At the hospital that I work at in Montreal, this is a 650-bed hospital, we have 9 infectious disease physicians just in that one hospital. And it's not that I'm saying we need to have infectious disease physicians all over Ethiopia, but they don't even have enough infectious disease physicians to train general medicine physicians in infectious diseases, to train medical students in infectious diseases and the kinds of problems they're going to encounter in their everyday practice. So capacity building is a huge problem in a number of these countries. And it's not just building, it's retention. Because as we train people and they become more valuable, we then lose them not only externally, but internally, so that they go from being within the medical school system or the government system, either into the private sector or to work for non-governmental organizations where the pay scales are often way out of proportion to what the governments can provide. And so these are very big issues that we need to grapple with.
Well, Dr. Brewer, thank you very much indeed for joining us today on Global Health TV.